Hello, my name's Jasmine Graben, and today I will be doing my informative speech. What if I told you that there's a naturally occurring drug that can alter our consciousness and state of mind for the better, with lasting effects from 1 to 6 months? Psilocybin and other psychedelic drugs have been illegal since the late 1960s. The DEA states that psilocybin is a Schedule I substance under the Controlled Substance Act, meaning that it has a high potential for abuse, no currently accepted medical use and treatment in the United States, and a lack of accepted safety for use under medical supervision. But in recent years, research through Johns Hopkins has proved that statement to be wrong. The research at Johns Hopkins on psilocybin may lead to a better way in treating mental health disorders, substance and alcohol dependency, and other issues the human mind may have. I first found out about psilocybin through a book called How to Change Your Mind: What the New Science of Psychedelics Teaches Us About Consciousness, Dying, Addiction, Depression, and Transcendence by Michael Pollan. This book had a load of information on not just psilocybin, but other psychedelic drugs and how their therapeutic properties are being researched. I found the book and the idea of a naturally occurring fungi being used to help in medical research, especially mental health research, fascinating. Although the studies of psilocybin have been limited and are still in their infancy due to research being halted in the 60s, Johns Hopkins' current research is picking up where past researchers left off. They have done countless studies since the early 2000s and are on the road to trying to reclassify psilocybin from a Schedule I drug, one with no medical potential, to a Schedule IV drug, such as prescription sleeping aids, but with tighter control. I'll be going over 4 studies conducted by Johns Hopkins medical researchers on how psilocybin affects different groups with varying problems. In 2006, Johns Hopkins published their first psilocybin study. The researchers chose 36 mentally and physically healthy volunteers with no history of hallucinogen use and no family history of mental illness. The double-blind study resulted in the volunteers having profound mystical and spiritual experiences. After 1 month, 80% of participants rated the experience among the top 5 significant events in their lives. 90% reported increased satisfaction and positive behavioral change, with increased positive mood and better social relationships. The results of this study were an important finding which helped start worldwide research on psilocybin effects. But what if the drug didn't just help healthy people, but also those with nicotine addiction? Johns Hopkins published another study in 2014 where they chose 15 men and women who, on average, smoked 19 cigarettes a day for 31 years. The results of this study showed that 80% of participants hadn't smoked for 6 months, comparing to the drug varenicline, the most effective smoking cessation drug, where only 35% stopped smoking. This study shows that psilocybin may aid individuals in treatment for addiction and substance abuse. If the effects can aid a long-time smoker in quitting, then it should be able to aid in mental health issues. A small double-blind study published in 2016 was conducted to see the therapeutic effects of psilocybin on 51 terminally ill cancer patients that suffered from anxiety or depression due to their cancer diagnosis. The results showed that the psilocybin decreased clinician and patient-rated depressed mood, anxiety, and death anxiety. Also an increased quality of life meaning, and optimism. After 6 months, 80% of participants showed continued decrease in depressed mood and anxiety, with about 60% showing symptom remission into normal range. If terminally ill cancer patients showed significant decrease in depressed mood and anxiety, the people who don't have cancer but are still depressed may show similar results. With this study, Johns Hopkins recruited 24 individuals with long-term major depressive disorder to see the effects of just 2 doses of psilocybin. The 2 doses were given 2 weeks apart. At the 1-week follow-up, 67% of the 24 participants showed more than 50% reduction in depressive symptoms. 71% showed a reduction at the 4-week follow-up. 54% of the participants were in remission, no longer being qualified as depressed after the 4-week post-treatment. Results like these are paramount for future studies in psilocybin and how its use may be able to help a wide range of mental health disorders. Though the research that was being done for psilocybin was stopped due to it being made illegal and being categorized as a Schedule I drug, the recent studies at Johns Hopkins are proving that psilocybin may have a medical use. That use seems to also help a variety of different mental ailments with quick and lasting results. Each study showed how the effects of psilocybin can affect different individuals. The first study shows how an already healthy person can improve their satisfaction with life and give them a profound mystical experience. The longtime smokers are able to completely stop smoking 6 months after the use of psilocybin. Terminally ill cancer patients show decrease in depression, anxiety, and learn how to appreciate life. And lastly, individuals who have major depressive disorder also show significant decrease in depressive symptoms, with some not having any more depressive symptoms at all. These studies are showing the amazing medical effect psilocybin can produce. As research continues to progress, we can see what more uses it may have. Thank you.